Hey, good morning, everyone. It's 10 o'clock and we're going to get started. I just wanted to let you know that everybody will remain muted and that our questions will be answered at the end of the webinar. There is a webinar, a question and answer feature at the bottom of your screen. Just click on that and you can type in your question. So at the end also we will be sending a survey tomorrow to everyone to fill out, and then we will send you a link to the presentation. So without further ado, I will introduce Amy Ronshausen, Executive Director of Drug Free America Foundation, to speak on our topic today of the impacts of marijuana and opioids on today's workplace.
Thank you, Karen. Thank you guys for signing up for the webinar. I know that this is a topic that sometimes is a little confusing and people want a lot of information on, so we're hoping today we can provide you with some of the impacts that marijuana and opiates are having to the workforce, and then also some different strategies that you can use. As Karen said, I'm Amy. I'm the Executive Director of Drug Free America Foundation. We've been around for a little more than 25 years, and our mission is to create strategies and things that promote primary prevention, increase access to treatment, and promote recovery efforts. So this is an issue that we work on a lot because of all of the changing marijuana laws and also the current opioid crisis. So we'll go ahead and get started. So employers play a very important role in shaping the health and safety of their employees, their families, and the communities that they live in. Businesses are a big part of our communities. So taking strides to support employees and families can have measurable positive impacts not only on their lives, but also in the success of the business. With changing marijuana laws and the current opioid crisis, an employer's role as an agent of change is as evident as ever. In the workplace, marijuana and opioid-related issues are impacting the businesses and the safety and well-being of their employees. So before we start getting into the impacts of these different issues, we want to just take a quick look at the big picture when it comes to global drug consumption. So according to the 2019 World Drug Report that was published by the United Nations Office of Drugs and Crime, in 2017, which is the most recent year we have data for, which sometimes isn't great, but if you think about collecting data across the globe, it takes some time. So 2017 is the most recent year we have these numbers for. And in 2017, it was estimated that 271 million people worldwide aged 15 to 64 used drugs at least once in the previous year. This represents 1 in every 18 people. And so you can see from the infographic that was created by UNODC, cannabis marijuana is the most widely consumed substance outside of alcohol when we look at global drug consumption, followed then amphetamines and prescription stimulants, ecstasy, and cocaine for the things that they tracked. Substance use permeates every aspect of life for those suffering from addiction, and that behavior doesn't get put on hold during a 9-to-5 job. So employees engaging in substance use during the work hours is a more common occurrence than most people think, regardless of random drug tests and the risks of discovery. So when we look at the big picture and we concentrate on the United States, we see that research shows us that 70% of Americans who use illegal drugs are employed. So this is something that we talk a lot about when we talk about reducing the stigma. These are everyday people. These are our neighbors. These are our families, our friends, our relatives. So these are people who, are still functioning despite their use of substances, and that is being brought into the workplace. In 2018, the number of job candidates who failed drug tests reached the highest level in 14 years. And one study showed that in certain rural areas, half of job applicants were failing drug tests. So we've heard anecdotally from many employers around the nation, especially in states that have more lenient drug policies, that they have a really hard time filling positions, especially when it comes to safety-sensitive positions, because those positions might be federally regulated and they have to drug test and they're unable to fill them. So when we look at data that shows the leading cause of missed work days in the U.S., so compared to people who are the general workforce is estimated to miss about 10 days of work a year. So when we look at people that are suffering from different substance use disorders, take a look at the days in this chart compared to what the general workforce is missing. So I think that the biggest one that we can see is the one for a substance use disorder that's related to pain medication. So these would be many of your opioids and different narcotics. So that's 29 days in comparison to the 10 days of the general workforce. But even the other, we look at alcohol, it's 14. We have 15 by any kind of substance use disorder, 15 by marijuana, 18 days for illicit drug use disorder. So we see that, it's not only having an impact on these individual lives, but if you're running a workforce, if you're running a business, these absences could cause significant impacts to your productivity and just your general business well-being. So how do employers feel about this? So there was a survey done by the National Safety Council, and they looked at, they did a national survey, a drug survey for employees, and 95% of them, of course, were concerned about the cost and benefits. So when you're running a business, a lot of times money is the bottom line, unless you're working for a nonprofit doing drug prevention. So when you think about running your business and you think about those lost days, the different healthcare costs, they're very concerned about the cost of benefits, 95%. The ability to hire qualified workers. So, this is always a concern, but that concern gets amplified when you think about the number of people who are applying for jobs that may be suffering from a substance use disorder or that might be using drugs recreationally occasionally. The cost of workers' compensation, a pretty significant concern over the illegal sale of drugs or drug use in the workplace, or concern of drug misuse. So this might be if we're talking about a person that has a legitimate prescription but isn't using it as they should medically. So maybe they're taking more than prescribed, things like that. So getting into the crux of what we're going to talk about today, the impacts of marijuana and opioids on the workforce, just kind of to set the scene, most of what we're going to be talking about from this point on is specific to the United States when it comes to the impacts of marijuana, because 11 states plus the District of Columbia has legalized the possession, distribution, cultivation, and retail sale of marijuana. So we have a lot of data coming out of those states. And then also we have 34 states plus the District of Columbia that have some kind of medical marijuana law on the books. So, this isn't just a state-specific concern. This is a concern throughout our whole nation because of the changing marijuana landscape when it comes to these policies. So there was a survey done by drugabuse.com that talked about medical marijuana in the workplace. And interestingly, they found that most people are more likely to stick to their recommended amounts if they're using medical marijuana in the workplace. So, this could be a whole different webinar on the issue of medical marijuana, but in the states that have legalized marijuana as a medicine, it is a recommendation that you would get from a physician, and you would pick up the product through a dispensary. And so according to this survey, they see that most of the people are likely to stick to those recommended amounts. However, they found that 20% of people do use more than recommended during the work hours, and people who work from home full-time are more likely to use more than recommended when it comes to medical marijuana. The concern would also still be that even if you are using the recommended amount, marijuana is still impairing whether you're using it as a medicine or not. So to be using during work hours or at work is a significant concern for employers. They also looked at recreational marijuana in the workplace, and according to that same study, more than 1 in 5 respondents said that they've used marijuana recreationally at work during work hours. 5% admitted to using daily, and more than 13% used it more than once a month. So these laws are having a significant impact on the prevalence of marijuana in our workplace, and it's something that employers need to be trained to be able to see the different behavior changes or the possibility of impairment in the workplace, knowing that these things are happening. So marijuana continues to be the top of the list when it comes to the most commonly detected illicit substances across the workforce in all categories and specimen types. What that means is the categories are the general U.S. workforce, federally mandated safety-sensitive workforce, and combined U.S. workforce, which includes all of the above there. And the specimen types that they're discussing are urine, oral fluid, and hair samples. So if we look according to workforce testing surveys or data collected by Quest Diagnostics, which we mentioned earlier, that the rate of positive drug screens have hit a 14-year high in 2018. When we look at the urine testing for the general workforce, we see an 8% increase from 2017 to 18. And while that doesn't seem too significant, it's not in double digits, but that's still a big increase. If we look at it from 2014, it's a 17% increase. When we look at the federally mandated positions, and these would be things that are maybe regulated by the Department of Transportation, so you're thinking about truck drivers and things like that, that's a 5% increase from 2017 to 18, but a 24% increase since 2014. So they're very significant. And when we look across the workforce, the workplace, so year-over-year increases with at least 20% of an increase in marijuana positive rates between 2015 and 17, these are the categories that they broke it down to. So you can see the highest is the 33.3% in both the transportation and warehousing category, and then other services. If you look at the construction, 26.7%, and you can see the different ones on here, accommodation and food services, so like hotel industries and the entertainment industries, 20.7%, retail trade, 18.5%. So we are seeing significant increases across the board in all different categories of the workforce. In the U.S., we mentioned that we have 34 plus states with medical marijuana laws and 11 plus the District of Columbia with so-called recreational laws. So most state marijuana laws either specifically permit employers to restrict marijuana use by employees, or they don't mention it at all in the legislation. So if they don't mention it, that means that it stays at the status quo. So whatever's happening now with the law in your state is how it would remain. Employers can still test and discipline for marijuana use in the same manner as other illegal drugs. And even in states that say that employers accommodate it, it still isn't accommodating the impairment in the workplace. So there are things that you can do through your drug-free workplace policy. So for recommendations for this, we recommend that all employers continue to test for marijuana. Studies show that drug testing works. Employees are 3 times less likely to produce a positive test result if they know they will be tested. So if you are hiring and in your hiring process you outline your drug-free workplace policy, and that policy says that there's drug testing in it, that acts as a deterrent for that employee to use drugs through the future of their employment. A drug policy must be very specific and supported by the workplace procedures to reduce the chance of litigation. Drug policy and workplace procedures should be reviewed by an attorney or lawyer to ensure that they comply with the state laws. And because this is something that's different in every state when it comes to U.S. policy, it is very important that you know your state law and you're not basing it on something that's happening in your neighboring state. And policies must be updated frequently to keep up with the changing laws and attitudes. The health and safety of your workforce depends on it. So it's not just marijuana, but before we move into the slides to talk about opioids, It's important to know that other drugs also pose a significant risk to the workplace and workforce. So earlier we talked about the different sectors when it comes to the workforce. And if we look at between 2015 and 2017, you see in the retail trade sector, there was a 43% increase in cocaine positive test results, and marijuana results increased more than 18%. When we're looking at transportation and warehousing sector, again, a significant increase in cocaine use, more than 22%, and also marijuana at 33% of an increase. In the educational services, we have an increase of amphetamine positive tests of 14%. In the construction trade, which we talked about earlier with the marijuana at 26%, they are also seeing an increase of 33% higher cocaine positivity rates than the general workforce. And in the manufacturing sector, both marijuana and methamphetamine positive drug screens have increased by 23 and 27%. So it's important that while we always talk about marijuana and opioids, because these are the two substances that create the most policy debate, it's important to know that, you know, the other drugs are still out there. They haven't gone away. We still need to be concerned about alcohol, methamphetamines, cocaine use, because all that's still out there. This is some information from employees that were seeking help through a confidential cocaine hotline. And I thought it was very interesting because these were people who were calling into the hotline. So at that point, because they're already taking that step, you know, they know that drugs, you know, 64% of them reported that drugs negatively impacted their job performance. But 44% of them admitted to selling drugs to other employees. 18% stole from their coworkers to support their drug use. 10% reported missing work because of a hangover. 6% admitted going to work high or under the influence of alcohol in the past year, and 18% skipped work in the past month. So whether you're a big business or a small business, when you look at these numbers, these are significant impacts to what you're trying to do daily as a business. You know, some of them are just, you know, dangerous and illegal. I mean, for the safety of your other employees, you don't want to have an employee who's stealing, who's selling drugs, who's coming to work high or under the influence. And then for your productivity, you know, people being absent, skipping work, not coming in because they're hungover, all these things play a big role in the success of your business. So we'll move on to opioids. So we've all heard of the opioid crisis. It's in the news. You know, you pretty much have to be living under a rock at this point if you are not aware that globally we have a crisis when it comes to opioids. The impacts across the globe are different, and even in different regions within the same country, the impacts can be different, but the crisis itself is well known. However, if you go to Google and you type in the word opioids, the first thing that pops up as the most search are what is opioids. So let's just take a second to look at what we're actually talking about. So opioids are a class of drug that include heroin, illicit heroin, but also includes synthetic opioids such as fentanyl and pain relievers that you can get by prescription. So Oxycontin, hydrocodone, codeine, morphine, and those things. So it's a pretty big category. So we're talking about, you know, a big class of drugs here. And then also these, you know, we're talking about fentanyl. This could be the fentanyl that's used medically that's prescribed, or also we could be talking about the fentanyl analogs that are being sold online or sold on the street non-medically. So it's a large class of what we were talking about. And what do we know about the crisis? So before we get into the workplace, like, what do we know? We know that roughly 21 to 29% of patients who are prescribed opioids for chronic pain misuse them. And the sources for all of this are at the bottom of the slide. Between 8 and 12% develop an opioid use disorder, and an estimated 4 to 6% who misuse prescription opioids transition to the use of heroin. About 80% of people who use heroin first misuse prescription opioids. According to the CDC, in 2017, more than 17% of Americans had at least one opioid script filled with an average of 3 opioid prescriptions dispensed per patient, and the average number of days for that prescription was 18. So since then, since 2017, several states have passed legislation that limits the number of initial days that an opioid could be prescribed. So I think that when we get the new numbers for 2018 or 2019, the average number of days for the prescription might go down. But what we need to remember is when we control these substances, which I'm not arguing that we shouldn't, when we put these tighter controls on this, so we make the abuse of prescription drugs harder, that doesn't cure people from their opioid use disorder. They're going to be going out to replace that prescription that they can no longer get as easily with substances like heroin or fentanyl or some kind of street drug. So as we look to curb the numbers in this category, we have to be aware that we might be bringing up, and we have been bringing up, the numbers in the illicit drugs category. So 23% of the workforce has prescription drugs that they use non-medically, and according to the CDC, the economic burden of prescription opioid use alone, so not looking at the whole substance abuse issue, but just focusing in on just the economic burden of the prescription opioid misuse in the U.S., costs $78.5 million a year. So this includes healthcare costs, lost productivity, treatment, and also involvement in the criminal justice system. Well, we have to remember it's not just the employees that are taking the opioids or the prescription drugs non-medically. Even if an employee is prescribed a dose of our narcotic, they could still be too impaired to work, even when they are taking it as medically directed. These drugs interact differently with every person, and depending on what your employees or your position within the company is, being able to be aware and notice those changes in behavior, or to be able to see and recognize the signs of impairment, is very important for a manager or somebody in the workplace, because it might be that while somebody's on that prescription that they're taking as directed, they might need to move to a different position so that they're not impacting their safety or somebody else's. So I thought that this one was an interesting survey, that this was a survey done by a number of businesses in Indiana, and they asked them different questions and different things that they observed through the workplace. And I'm just going to highlight a few that I thought were worth looking at. When you have time, you can look at the other ones. But that 59% of them saw the use of prescription painkillers at work. That 23% borrowing or selling prescription drugs at work. 19% saw a near miss or injury related to prescription drug usage in the workplace. And what I think is most alarming, because we just don't, this isn't something that we think about, and it's something that we need to be thinking about, is that in the workforce here in Indiana, there was an observed 5% observed an overdose. So that is, truly concerning. When we think about people being revived from an overdose, we don't necessarily think of them being in the workplace, but this is the reality. Remember, I said at the beginning, we have to reduce the stigma associated with who might be using these substances, and the reality is it's our family, it's our friends, it's our neighbors, it's people that are very close to us. It could happen to anybody. So we have to be prepared for these kind of things to happen in the workforce. This is a reality of the opioid crisis. So this, I thought, was a really good infographic made in partnership with the CDC, and it talks about the number of drug overdose deaths at work is rising, and what the top 3 industries are. So we look at, and these are some of the ones that continue to come up in our discussions throughout the webinar so far: the transportation and warehousing sector, the construction sector, and then this one is the healthcare and social assistance sector. So we look at the deaths, this is from 2011 to 2016. So when we look at the overall deaths that are happening around the country, in the U.S., on a daily basis, there are a significant amount of them happening in the workplace. So this is a good opportunity for training on naloxone and is this something that your workplace should be carrying. These just bring up some new things to consider if you haven't already as an employee, to bring to your employer, or if you're an employer, something that you might want to consider having at your workplace, the overdose agent, and then train your employees on how to use it. When it comes to impacts to the workplace specific to opioids, opioids can be associated with injury in the workplace, as can any substance that is impairing, even when taken as prescribed. We've talked about absenteeism, and this particular research showed that individuals suffering from an opioid use disorder were absent almost 50% more than the general workforce, and that goes back to that slide we saw at the very beginning. Decrease in productivity, substance use, misuse, and related disorders are estimated to cost more than $400 million in lost productivity when it comes to workplace. And 36% of people with substance use disorders and 42% of people with opioid use disorders related to pain medication worked for more than one employer in the last year. So it's a lot of turnover with this population compared to 25% for the general workforce. And it costs a business an average of $7,000 to replace a salaried worker. So this is something that, you know, not only impacts the individual but impacts the workforce. And then healthcare costs for employees who misuse prescription drugs and have substance use disorders are 3 times higher than those for the average employee. And then some general impacts to the workforce outside of, you know, when it comes to all drug use, and some of them we've talked about already. But the after effects of substance use, the hangover, being in withdrawal at a workforce, the theft, the lower morale of coworkers. So this is one that I think is important to think about. You know, we all have, you know, we're all in workplaces, and you think about the load of work that you carry, and if you have employees or coworkers that are coming in under the influence, or that are absent more often because of their substance use disorder, that just means it's going to be more burden on you. And when you have an employee who feels that burden, they're just going to get burned out quicker, and it's going to be harder for the employer. Illegal activities at work, a high turnover, the training of new employees, disciplinary proceedings. Those are some of the different impacts. So I want to close by just telling you a couple things about drug-free workplace programs, but I want to reiterate that for us, drug-free workplace programs are not meant to be punitive. We know in some cases that that's the only choice. If it's a safety-sensitive position and the person fails a drug screen, we know that they can't continue to drive that school bus if they're failing drug screens. But maybe there's another position within the company that they can be put into while they take advantage of maybe some of the EAP programs that might be provided through their employer. We want to make sure that we see the workplace as an opportunity to get people into the care that they may need and to promote long-term recovery. We know that an employee who is offered those services and who ends up going through treatment and remains with their employee tends to stay with that employer for a very long time. They're just more loyal. And if you've invested in that person's life, so you're just creating that relationship that goes a little bit beyond what you would with a general workforce. So drug-free workplaces are there to protect the health and safety and the productivity of the workplace and workforce. They boost community prevention efforts. They can educate on the harms of substance use and misuse. You have a captive audience when it comes to your employees, and this would be a great opportunity to tell them about some research about different drugs of abuse and to tell them about the different programs that are out there in their community that they might be able to access if they or if one of their family members are suffering from a substance use disorder. Encourage employees to remain drug-free, support treatment and recovery efforts, and all of this just helps businesses thrive. So for more information on how to set up a drug-free workplace program, because that isn't really what we were talking about today, one of the places that you can access this information from is the National Drug-Free Workplace Alliance, and I've provided the website there. And then just for more information in general on drug-free workplaces, the impacts of substance use on our communities and in other areas of life outside of the workforce, I would suggest looking at ISIP, the International Society of Substance Use Professionals. They have a phenomenal website that has a whole bunch of different categories on it. And if you become a member of ISIP, and the link is there to do that, once you have membership, there's a whole bunch of different work groups, virtual work groups that you can join. We do have one on drug-free workplace, but there's a whole bunch of different ones, so it's a really great resource for you if you are in the field of prevention, treatment, or recovery, or just somebody who wants to know more about these issues. So I will turn it back over to Karen, and she will let me know if there are any questions.
Okay, everyone, you can answer. Some of you came on after we started. There is a question and answer feature at the bottom of your screen, and that is how we would like you to type in your questions. So if anyone has any, you can type them now. So. Amy, I'm going to ask
Okay.
you a question while we're waiting for questions to be typed in. Is what would an employer do if they suspected an employee was under the influence, or perhaps they had tested positive, or they discovered that the person had an issue with substances? Is there something that would be a great a recommendation or a thought to help them?
Well, that should all be covered in their drug-free workplace policy. So if they have a drug-free workplace policy, it would be very important to make sure that they're adhering to the steps outlined in that. You don't want to, treat one employee different from another. So if you have specific steps that would be taken, you want to make sure that you're doing that within the policy as prescribed by your employer.
I know that one thing that we, when we help employers establish a new drug-free workplace program, we have a listing of places in the community that employees can get help, and it might be for themselves, it could be for one of their family members or friends that needs assistance, and so having resources in your communities is always a good thing to do. We encourage employers to, kind of post those on the bulletin board or have those available so that the employees can always access them, as well as you want to make sure that they can always access their drug-free workplace policy, so that if they have a question about what might be legal or what is going to be tested for, that they can access that policy on an ongoing basis. So. Well, we again, last call for questions here. If not, we are going to be sending out a survey tomorrow, and then we will also send out the link for the presentation. So we do have another question right here, Amy. As a starting point for our coalition within our community, do you recommend we go through the chamber, et cetera, to make information available and provide a workshop?
If you mean providing a workshop on the impacts of substance abuse in the workforce, I think that's something that the coalition can do. As a coalition, and I'm assuming you mean an anti-drug coalition. If
Right.
you're an anti-drug coalition, then you would be the experts, and I think that getting the chamber involved and maybe partnering with them on an event like that would be really good. But these are some one-pagers that you could put on your website as a resource and that you could provide to your coalition members. And hopefully as part of the coalition, as part of your capacity building, you're reaching out to some local businesses. I'm sure you have those as part of your coalition already, so maybe partnering with them as well.
Okay, and we can also, on the NDWA, the National Drug-Free Workplace Alliance website, we also have some other, like one-pagers and other resources that are downloadable that you can utilize. And if you have any specific information that you need, you can give us a contact. We have another question here. Do we have any specific assessment or screening tests for drug use under employee assistance programs? So,
I'm not sure about that, but I think that one thing you need to keep in mind is that you're not looking for drug use in your workplace. You're looking for behaviors. You're identifying problematic behaviors, changes in behaviors, having a tool that your managers are well trained on to recognize the signs of impairment, and I know that can, I think, can be found on the NDWA website as well. And then there are procedures for, best practices when it comes to drug tests, and those, I'm assuming that those would be on the website as well, Karen.
So I think also now an employee assistance program is a tool that employers can use. It's actually a benefit, and it can be used for a variety of things, but in regard to substance use or problems, an employer can refer an employee basically for any reason. If they suspected there might be a problem, the employer can refer them directly to that employee assistance program to get to address whatever the concern is. And so that is actually a tool that employers can use. What the individual employee assistance programs have as their tools, I don't know that it's a drug test, but certainly it would be an evaluation of some sort for each person who is referred. So, okay. Any additional questions? And I think we're at the conclusion. Again, we will send out a survey tomorrow to all the registered participants, and then we will get a link up of the presentation and let you know where that is. Okay. So, well, thank you very much. Thank you, Amy. And this is the first of a series of webinars on the workplace topics that we are having this year. So we will certainly let you know that when the future topics will be coming up, and hopefully you'll join us for those. So thank you very much, and have a good rest of your day. Bye-bye.